Hey, welcome back to Neurodegeneration and AI in the Gulf. I'm Sohith, and in today's episode, we are zooming in on the Gulf region, looking at how countries like Qatar, Saudi Arabia, Oman, and the UAE are shaping healthcare policies and support systems for neurodegenerative patients. This conversation comes at a pivotal moment as these nations face both a growing aging population and a rising incidence of diseases like Alzheimer's, Parkinson's, and other neurodegenerative disorders. In recent years, national healthcare agendas across the Gulf have started to reflect a serious commitment to neurological and geriatric care. Take Saudi Arabia's Vision 2030, which places a strong emphasis on enhancing neurological services, early diagnostics, and investment in advanced treatment centers, while Qatar's National Health Strategy 2018 to 2022 includes specific goals to improve long term care for patients with dementia and similar conditions. These strategic documents signal a growing recognition that neurodegeneration is not just a clinical issue, but a policy challenge. However, a good policy doesn't always guarantee a perfect implementation. While funding is available, specialized neurodegenerative care units are still concentrated in urban hubs, leaving rural populations underserved. Infrastructure expansion is happening, but slowly, and that's where AI technologies can help bridge the gap through remote monitoring systems, virtual neurology consoles, and predictive algorithms that can help flag high risk individuals even before symptoms progress. Another hurdle is the cost of care. Neurodegenerative diseases demand long term, high cost interventions like MRI and PET scans, specialized medication, and ongoing management. While public hospitals cover many of these expenses, the system is often overwhelmed. Patients frequently turn to the private sector for faster access, but at a steep price. This duality between public coverage and private efficiency creates a pressing equity issue. AI might again offer part of the solution by improving scheduling efficiency, automating administrative tasks, and offering telemedicine based triage systems. Public hospitals can improve throughput and quality of care without burning their limited resources.
Let's take a closer look at the divide between public and private healthcare system in the region. Public healthcare in the Gulf, especially in the UAE and Qatar, is quite robust in terms of universal access. However, when it comes to specialized neurodegenerative care, the private sector often leads the way with better equipped centers, more neurologists, and shorter wait times, particularly in cities like Dubai, Abu Dhabi, and Riyadh. This leads to an unfortunate reality. Patients with financial resources can afford prompt and comprehensive dementia care, while others face long queues and limited options in public facilities. To address this, governments have begun forging public private partnerships. These collaborations are crucial to leveling the playing field. Programs like Dubai's Mashoda, which offers financial aid for neurological treatments, are prime examples of how such partnerships can work in practice. But disparities still exist, especially for the patient in less developed areas. AI is already playing a transformative role here. Natural language processing tools are helping doctors manage clinical documentation efficiently, while AI based track tools are being deployed to access symptoms remotely. These tools can detect patterns in speech, movement, or even facial expressions that correlate with early neurodegenerative signs. Moreover, Machine learning models are being used to predict patients' outcome and personalize treatment plans. These systems learn from electronic health records and imaging data to help doctors make more precise decisions. Integrating such AI tools into both public and private systems could significantly reduce care delays and geographic disparities. If used thoughtfully, AI could democratize access to top tier care, regardless of income level or location. But that's the only possible with supportive infrastructure, cross sector coordination, and digital literacy among healthcare providers and patients alike.
One of the most critical bottlenecks in Gulf healthcare systems is the shortage of skilled personnel. There is an ongoing lack of trained neurologists, geriatricians, nurses, and long term caregivers, particularly in Oman and rural Saudi Arabia. Most facilities still rely on foreign trained professionals, leading to variability in treatment protocols and patient outcomes. Nursing staff and home caregivers are also short in supply, and those in the field often lack proper training in dementia and neurodegeneration care. This can result in emotional burnout, inconsistent caregiving, and high turnover rates. While countries like Qatar and the UAE are investing in geriatric nursing programs and specialized caregiver training, these efforts are still in early phases. Interestingly, AI driven training simulators are beginning to change the landscape. Virtual reality platforms and AI avatars can now simulate real world patient scenarios, enabling nurses and caregivers to learn on demand and in context. These tools offer culturally adapted training modules that are especially useful in Gulf's multinational, multilingual settings. AI is also making headway in caregiver support. Smart home systems can monitor patients for falls, wandering behavior, or unusual activity. When combined with wearable health trackers, these solutions offer a layer of safety for both professional and home caregivers, alerting them instantly if something goes wrong. Ultimately, training alone won't solve the workforce crisis. We need policy reforms that incentivize caregiving, improve mental health support for healthcare workers, and integrate AI tools as co pilots in patient care, augmenting rather than replacing human compassion and clinical judgment.